Well, good afternoon, everyone. Here it is morning. I'm in the US, and I recently moved from Boston to New Hampshire. So you may detect my Boston accent because you can't take the Boston out of the girl. So this morning I will be talking on the topic of death, and I am a registered nurse of 45 years. I have helped many people pass over. And so I would like to share with you some of my experiences of the most beautiful transitions from one world into another world. So I do have a PowerPoint, and if I can just share my screen, we can begin. Oh, it's not there.
I'll just mention here that you just talked about helping people pass over, and the country here in Israel, we're going crazy getting ready for Passover.
Really?
No, we're not passing over, we're Passover.
Now, cannot, I just shared my screen, but my page isn't here.
Okay, hang on. Let me remove the pin and try again.
No, it's not my page. Oh no.
Oh.
Let's click this and see what happens. Now I've got 100 pages. Okay, so I would like to talk about how we come into this world and how we leave this world. So both birth and death are big transitions of the human body, and nurses are present for both. So I've delivered many babies and brought them into the world, as well as helping people pass over. So I believe that we are built to be born. We survive our birth and we survive our death into the afterlife. I always love this saying from Ben Franklin that in this world, nothing is certain except death and taxes. So each one of us is going to die. Each one of us will face death, as well as the grief that comes with it when we lose someone that we love. So I have found, working with families in the hospital, death is a big fear for most people. Especially if there's not a great spiritual background. People are afraid to talk about death, and they are afraid to die. So hopefully explaining how the process goes will help people to not be afraid and to see the beauty in the transition. It's a conversation in the hospital that's usually very uncomfortable when your loved one is ill and we have to approach the subject of death. It's very unpleasant to think about, and people would at this time begin to contemplate their religion and maybe turn more to God. I have seen a lot of time that people will see serious disease and a death prognosis as a punishment, and especially if it's the death of a child. So as I go along, I'd like to go through each section and then invite any questions. So when I'm ready for questions, I'll let you know. Is that okay? Okay. So let's start from the beginning. First, to know that in my view, there are two kinds of deaths. There is a death by trauma. So if you were gunned down or beaten to death or had some violent attack, you die differently than if you die warm and cozy in your bed in a natural death. So I will be talking about a natural death. So once you've gotten a diagnosis, you need to really come to terms with impending death, settle your affairs. A lot of times people give away their valuables, and you'll execute a living will and testament. You'll need a power of attorney, and then you begin your bucket list to do all the things you wanted to do while you were in this life. As the disease progresses and treatments are no longer an option, we usually will approach the family with a DNR. A DNR means do not resuscitate. So there are certain levels of DNR. Some people would like heroic medication, but not CPR, or whatever it is that their wishes may warrant, we will write them all down and honor those wishes. So when you are a DNR, we typically will stop all heroic treatments like chemotherapy. Now, if something were to happen meanwhile, perhaps you developed a pneumonia or a urinary tract infection, we will still treat those, but nothing will be done to save your life. So you will still be fed, have an IV, care and comfort measures. And then usually we will call in hospice services. You will come into hospice when you are 6 months or less to live. That is their requirement. So as people are chewing on the fact that their life is coming to an end, we really need to come to terms. And how we grieve has been described by Elizabeth Kubler-Ross. In the following months, we come to terms with our destiny through the stages of grief. The first stage is denial. People go through these stages in and out, and nobody grieves this, we all grieve differently. So if someone is laughing because they're going to die, that's just their way of accepting it. Can't really judge if someone is grieving. There is no correct way. We all do it in our own way. And, this doesn't just apply to death. We need to come to terms with all kinds of things in our life. Anytime we've had a loss or we need to grieve, these are the stages we go through. So first, for a moment or even longer, we don't accept it. So it's that energy coming into our vibration that we're rejecting it. This isn't true. This can't be happening. I don't believe it, until finally you do believe it. And then you're really angry about your diagnosis or your loved one's diagnosis. You're angry at the disease, you're angry at the doctor, and all of this anger is completely normal. In fact, some of it is very inspirational. It may inspire you to quit smoking or, take better care of your health. Then we begin to bargain, usually with God, and people will say, well, God, if you just give me back my health, I promise I will do X. Then we'll go into a little state of depression, sadness, until we finally come to the acceptance. And you can just look at your own life and see how these stages of grief, we've all been through them. Okay. So as we prepare for our transition, the transition is the body is going to slow down and stop. So everything needs to slow down. The heart slows down, the blood pressure lowers, the nervous system isn't as acute, circulation is impaired, digestion is impaired. Everything slows down until we finally stop. So we no longer really need fuel, calories, because we burn calories because we are always regenerating. Well, we're not regenerating anymore. So you will find that the appetite is much less. And the families at this point, well, mama, eat, you have to eat. You really don't have to eat. In fact, the less you have in you, the easier your transition is. So when the body gets all sort of clogged up with saturated fat or just excess of any kind, the energy can't move through the chakras and the meridians as well. So this is a real big time of cleansing and discharge, so that the spirit can move through and be on its way. This is a huge transition. So there are some phenomena that occur during the days, I'd say 3 weeks to the day of death, and I'll go over those. So this is a good time so far, if there are any questions as to where we are right now.
How accurate is a doctor's prediction, how long you have to live? Can you really depend on that?
It's a guesstimate. If 100 people have congestive heart failure, then we can know, well, the heart can only sustain this for, 3 months or 4 months. So it's a general ballpark. It's certainly not etched in stone. We have seen people outlive what the doctor's prediction, but it's usually a good, especially with cancers. Some cancers are more aggressive, and you could probably tell how much time somebody has. So it's a good guess.
Donna,
Yes.
you mentioned laughter and as an indication of acceptance.
Yes.
Can you describe one or two of your patients who?
Sure.
Mhm.
When the doctor comes in and explains to the family that, your mom or your dad is dying and within the next week. So, please call family in. This is the time, if you want to have a vigil in the room. And, the loved ones might, oh, that's so funny. And they're in there drinking and carrying on. They're either in much denial that this isn't really true, or this is just their way of grieving. So anytime somebody has a response that you might think is inappropriate, it's just their normal way of acceptance.
And what about from the patient side? When the representative, either the doctor or the nurse, tells them that what's going on, and they start to laugh.
Well, I think sometimes patients have a very good sense of humor, and a lot of times the patient doesn't want to infringe upon their family and make them feel bad, so they need to be strong. They feel like they need to be strong for others. So in their silence, they may grieve, but in front of people, they may joke and make, laugh.
Good.
Yeah.
Yeah.
Good question. Okay, I'll move on. So these are the stages of active dying. Like I said, about 2 weeks before, we begin to see, if you're warm and cozy in your bed like this girl, you will find that patients have hallucinations. Now, these hallucinations, we call them hallucinations. I believe they're real visions. So people will say that their past parents, their past loved ones, their pets they used to have when they were a child, come to them and give them messages. Sometimes you'll see people reaching for something that isn't there, but they're having a vision of their loved one. Perhaps the loved one is coming to tell them, I will help you cross over, or it's going to be okay. This is very, very peaceful for the patient, and it's very normal. We do not interrupt any hallucinations or any visions. Just sit with the patient and let the patient explain what they're seeing. At this point, they're still coherent. They're still awake and experiencing these visions. You will find that as the body shuts down, we sleep more because the calories have been decreased, and we're cleansing, so we're sleeping, we're eating less, we become a little bit more withdrawn, and when you're eating less, you're excreting less. And then there is a short period we might find people have fevers, because I don't think they really can explain why we have fevers. I think whatever toxins, viruses, or bacteria are remaining in the body turns up the furnace to burn them off, so that when you pass over, you're clean. In the final hours of death, I would say this would be, the last stages of death. You are no longer eating and drinking. You're no longer awake at this point. The body goes into ketosis, because when you don't eat carbohydrate to burn, the body turns to fat and burns the fat, which is why the ketogenic diet is so desirable, because it's a quick way to lose weight. So when you're burning fat, the glucose isn't there. And this makes us go into a state of ketosis, which makes us very fatigued and even more sleepy. You can tell when somebody is in ketosis because you can smell it on the breath. It's a very fruity smell. A lot of times, real severe diabetics will be in ketosis, and we can tell by their breath. As you go deeper into ketosis, it affects the central nervous system because there's no more glucose in the body. And the way we are built, which is so beautiful, this state of ketosis helps us reduce pain and creates euphoria. So as we're sleeping and your loved ones are around, you feel beautiful and wonderful. Now, death in itself is not painful. There might be pain if you've had, perhaps bone cancer or a motor vehicle accident and you have injuries. That might be painful. But death in itself does not hurt. The crossover is beautiful. It is not painful. So as all of these processes are slowing down, calcium comes out of the cells naturally, and it increases our need for sleep. So there's many reasons why, as we pass over, we're sleeping. The death stare is something we see in a vast majority of patients, and the patients will choose a corner of the room and just stare. Now, this stare cannot be broken. If you shook her, she will not stop staring at whatever it is she's staring at. There's no blinking. This is completely normal. It happens all the time. I personally believe that we are working out our karma during this stare, that we are perhaps in a deep state of reflection or projection into the future, or something that we are engaged in some spiritual event. But that's just my opinion. That's not science. But this stare is completely normal and very common. Terminal lucidity is something that's really interesting because as the family gathers and, people are praying around the body and, they could be there for days with their loved one. All of a sudden, the patient will get up, want something to eat, telling jokes, go for a walk, as though nothing happened at all. And then the next day or 2 days later, they're back in bed sleeping and passing over. So it's this last minute short burst of energy that comes from we don't know where. And it's called the rally or terminal lucidity. And again, very common and very confusing for the patient because we have prepared them for them to pass over. And then all of a sudden it looks like they're getting better. Veterinarians have also attested that this applies to animals. As animals are dying, they also have a rally where for 1 or 2 days, they get up and they eat and they seem their old selves. And then they go back to the dying process. It's very interesting.
Donna, I remember that Michio taught that when a candle is just ready to burn out, it'll flame up or flicker strongly right before it extinguishes.
Isn't that interesting? Yeah, that's great. Terminal secretions is something that if you've never seen somebody pass over and you're with a loved one, this is a noise that you will hear them make. It's completely normal. The patient is not uncomfortable, but because the body is shutting down, the muscles are shutting down as well. So all the muscles that we need to swallow are very relaxed. So that saliva will collect in their mouth. And as they breathe, you hear the air pass over the fluid. They're not choking. It's just a very normal, it's not uncomfortable for the patient at all. And some people have referred to this as the death rattle, if you've ever heard that. We don't suction the patient. We don't remove those secretions because, the body will just make more and it's not uncomfortable for the patient. Now, this is, I don't know her personally, but I do follow her. Her name is Julie McFadden. You can find her on Instagram. under hospice nurse Julie. And, you know, she deals with death and dying for a living. And every day she posts things about death and dying and what it's like to be a hospice nurse. And I have a little video on another part of dying, which is called terminal agitation. Terminal agitation is when the patient becomes very fidgety and restless in the bed. Sometimes they'll take their legs and crawl up the wall, or they'll shake the railings, or they pick at the sheets. So I do have a little video of terminal agitation. Again, very normal and not disturbing to the patient at all. Now, this is on YouTube, so I might have to go through a commercial to get to it. So we'll see. Okay. Here we go. All right. No, that's not it. Yeah, we have to go through this commercial. Okay.
Donna, when you did share screen, did you do share audio as well?
I'm sorry, what did you say, Gannett?
When you do share screen, you also need to do share audio.
Oh, can you see this and hear it?
We can't hear it.
Oh.
If you make it full screen, maybe we could read the subtitles. Full screen on the right bottom.
I'm on full screen.
YouTube is not though.
Okay, well, let's see if I can move this. All right, now I have 100 boxes open. I'm so sorry. Let's see what we can find here. I don't have a full screen icon.
Donna, if you go back into the share link.
That is.
So this is about, I'm asking about people who are on medications and how does that affect their death?
That's right. Usually by the end of death, they have been taking off of most medications. Sometimes they will give certain medications to help with pain or bowels or urine retention or anything that's causing discomfort. But by and large, you're off of all of your meds that you would take for your heart or, you know.
So if there's some agitation or something going on and then they're
well, if they're
medicated.
if they don't need to eliminate, so you know their bladder's not full or their bowels aren't full and they're not in pain, we just let them be agitated. But if the agitation is from something that's causing discomfort, we will take care of that and treat it. But if it's just terminal agitation because that's part of the dying process, we just let it happen. Keep them safe. Sometimes we have to hire a sitter to come and sit with them to make sure they don't fall out of bed or hurt themselves.
Okay, I cannot. I have
Okay, so
everything set up and yeah.
I will
Go
share
ahead,
my
Donna.
screen again.
Go ahead.
You cannot start screen share while the other participant is sharing.
Okay. La-di-da, la-di-da. Hang on just a minute. We were so close. Well, just keep talking, Donna, until I figure out.
Yeah. All right. So this here, her name is Julie McFadden. She is a California hospice nurse. She is like a TikTok broadcaster. I find her on Instagram. Just search hospice nurse Julie and all of her videos will come up. And she talks on educating people about the death and dying process. All right, now where were we? I think I was right here. Okay, can you see on this white box, it says YouTube terminal agitation educational video? That's the only link I have. But just search for hospice nurse Julie and she'll come up. And she'll show you pictures of live action of the death stare, the death rattle, all the things that I've been talking about you can find.
Mhm.
Okay. So another thing that we see as people are passing over is their breathing begins to change. So this is called Cheyne-Stokes breathing. And I would say 90 to 100% of patients who are passing over will exhibit this type of breathing. And it's a series of very rapid breathing, shallow breathing, and then stop breathing. And then rapid breathing, stop breathing. And I have a little diagram here that shows you the rapid breathing and then the breathing stops, rapid breathing. And the rapid breathing is very shallow, like, and then there's no breathing at all. What else? Yeah, once someone is Cheyne-Stokes breathing, you know that death is imminent, maybe within, a day or so. Very common. All right, now I'm having, okay. So the final look as someone is passing, all of your muscles are relaxed because we don't need them anymore. We're moving on to the next life. So because our muscles are relaxed, the mouth will hang open because the jaw muscles are no longer holding our mouth tight. The eyes will be wide open because the eye muscles aren't keeping the eyes closed. And then you might lose bladder and bowel function because those two are muscles that hold things in for us. And the face sometimes takes a dramatic change because all the muscle features that make us who we are and all of our expressions and our mannerisms are now flaccid and gone. So I have noticed that as people have passed, that I wouldn't even know that was the patient I had been taking care of. That's how much their face can change. Personally, when my mother passed and her face changed, it was as though I was looking at my grandfather, like they were identical. It was a very dramatic change. Now, I want to talk a little bit about chakras because the chakras really are, what keeps us on this plane as a human, and they are involved with our birth and our death. So I do a lot of chakra work, and I do have a very detailed explanation of chakras that are in my book, Let's Act Like Rice, but I will briefly go over why this is important during our death. So during fetal development, as we are little youngins, we incarnate our spirit into our physical being, usually after the first trimester, I believe. And so we incarnate sort of like through our head into our body. But it doesn't happen all at once, because as we grow and evolve, our chakras become deeper and stronger. So your chakras at age 30 aren't the same as when you're 2. You will notice that we all have a little hair spiral on the top of our head, which is where these swirling whirls of energy come in. Is there anyone that doesn't know what a chakra is, that you've never heard this term before? Wheels of energy that intersect other wheels of energy, so that the 7 major chakras that line up on the midline of the body are really intersections of energy pathways and meridians that are sort of colliding together. Earth and heaven coming together, making a clash, which spins our energy around, which is a very strong magnetic force that attracts us to other people and connects us as humans. So as our chakras come into us as we're born, the chakras leave as we are dying. And so they come in from the top down, they leave from the bottom up. So as we are passing over, we begin to lose our base chakra between our legs and up to our bellies, and it goes up further until we are out of our body. Did I make that clear as mud? It's a hard concept to imagine. So I'm just going to go over the chakra system just very quickly. So I'm going to start at the base, because that's the first chakra to shut down, is the base chakra. The base chakra connects us to this earth. It keeps us rooted in, sort of like we grow roots out of our perineum. The chakra is like a funnel that faces downward into the earth, brings up earth energy into our bodies. This chakra is very associated with our survival as a human species, and very much in touch with our fear. The more fear we have, the more our chakra will be closed. It was very interesting to me as the COVID pandemic hit that everyone had fear. And what did everyone run out and buy?
Toilet paper.
Toilet paper. Base chakra, fear. To me, that was just, it just spoke volumes as to, yes, all of our chakras are all in fear, and we're going to run out and buy toilet paper. So as that chakra begins to shut down, it's going to affect the other chakras as well. So let's see if there's anything else I want to tell you about the base chakra. It's our basic need for food, clothing, shelter, and what connects us to the earth. The second chakra is the sacral chakra. It's about an inch or 2 below the belly button. Now, in some cultures, in some practices, they'll call this the Dantian or the Hara. And this chakra, to me, is really the most important chakra that we have. This is us at the most deepest level. All of our deepest emotions are stored deep in our belly. So anytime that you feel grief or you feel a very heavy emotion, if you really pay attention, you'll feel it deep in your belly, and then it might just travel up and, you know, be expressed. But all of our emotions start deep in the belly and work upwards. This chakra pertains a lot to our creativity, our sexuality, and of course, all the organs in this area are being fed by this chakra. So the uterus, the ovaries, each chakra is paired up with an endocrine gland, a particular color, certain stages of our life where this chakra may become more alive. So this chakra holds our little inner 2-year-old. And 2-year-olds are full of emotion. So the next chakra up would be the solar plexus. This is a yellow type of energy that is swirling around. And this chakra has a lot to do with our will. When we're toddlers or as we are becoming more autonomous, we put our will into the world, and that will either be supported or it will be squashed. And the more support we have, the more open and free this chakra will be. The chakra feeds all of our digestive organs, which we all know digestion is the key to all of our health. So keeping this chakra in good repair is vital. This chakra also reflects to the third eye because we have a gut-brain axis. So these two chakras are like, they're like buttons. If you press one, the other one pops out. You press that one, they work together. And this color is yellow, which I find interesting because bile, our digestive juices are yellow. And then the next chakra up is the heart chakra. I'm sure we have all felt emotion and feelings of love, giving love, receiving love, and what that feels like. This chakra is colors of greens and pinks. You can use these colors if you know your chakra system, if you know how to use your chakras and meditate with your chakras. You can use these colors in your wardrobe, in your decor, in your home, and bring these vibrations into your health. So the heart chakra is very associated with touch because our chest, expands out into our arms, into our hands. So when you're cooking your foods, you want all your love to be, flowing out your arms into the handle of that ladle as you're stirring your rice in your pot, so that all that love goes directly into your food. When we cook, when we're not in a good mood or we might be a little annoyed, that also will go down the handle into your food. So always cook with love. And when we touch with our hands, to touch with love. As a nurse, I have always found it very important to always keep one hand on my patient, whether I'm just talking to her or talking to someone else and not even paying attention to the patient, but my hand is always on their shoulder or on a joint. Our hands give and receive energy. And when we hold a joint, it just brings warmth and love to someone. So you can practice that yourself. Just hold someone's shoulder and just let that heart energy be open. So as the chakras are leaving and they're shutting down, now we're coming up to the throat. The throat is the seat of our expression. And it used to be that this chakra was most frequently blocked because people were hesitant to speak their mind. But I find that as we are evolving, that's not a problem anymore because people are very today outspoken. Not everything that you think needs to be said is what, I say. However, so singing and gurgling and grunting and making noises and expressing all of your emotions comes to our throat. It's sort of where the upper chakras and the lower chakras meet to be expressed. It's so beautiful to want to tell someone something important and you voice that and they hear you. It's a communication loop that keeps our throat chakras open. For me personally, I find that making a makeshift microphone and singing my favorite rock and roll music to the radio is a way that I can keep my throat chakra really open and healthy. So as the throat begins to shut down, you will notice that people's voices change as well because we don't have the musculature and the air capacity and the strength to keep our voice accustomed to what we're used to hearing. So a lot of times as people are passing, their voice is nothing more than just a slight whisper because we express and we speak from our gut, from our belly, deep within us. That's how, our voice comes out. When those chakras are no longer activated, the voice is very weak. Then we come into the third eye. Now the upper chakras are all spiritual. The lower chakras are all physical. The third eye is probably the most spiritual chakra we have. It pertains to the pituitary, the pineal gland that sits right behind here, and it's located right between our brow. This is our inner vision, our spiritual connection. And interestingly, as the chakras begin to shut down and we've come to the third eye, people see the light. This is where you get the saying to go into the light. This is because the third chakra is not only it's shutting down, but it's being activated because it's a spiritual event, is the transition. And there is a chemical that is released. I can never pronounce it. And that's why we see the light.
You said third chakra, you mean third eye.
Third eye, I'm sorry, third eye,
Mhm.
yes. It is called dimethyltryptamine. DMT is what it's called. And it's secreted by the pineal gland. And it's when you cross over, you go into the light because of the third eye. I have a whole chapter on the third eye. It's the most amazing coincidences you can find in your life because your third eye is open. It's a very creative energy that we bring in through the third eye. And so then by then it's, the crown chakra, it sort of reflects the same as the base chakra, where it's a funnel that sort of sits on top of our head. And that is the divine connection to our source. We bring in vibration through this, Earth's force comes in through us, heaven's force comes in through our base chakra, and where they collide is really what keeps us alive. So as we pass, the chakras break down one at a time, starting at the base and working our way up. By the time we come to the crown chakra, now there is what they call an energetic cord that keeps the crown chakra connected to whatever source, your higher self, and whatever divinity is in your life. That cord will break at some point. I have a slide on that. So just going back to the base chakra, as the chakras are breaking down from the bottom, circulation is greatly impaired because we don't need our legs and our feet anymore because we are leaving. So what we see is this condition called mottling, where the skin, the feet begins in the feet, and then it will, spread up the leg until the whole body is completely mottled. And it's a cold and clammy feeling because the circulation is diminished. Ironically, the patient does not feel cold and they do not feel uncomfortable during this. Like I said, it's painless. Couple of things I have here, just a few little tidbits that I may not have mentioned, that we were built to be born and die. We die how we lived. I have noticed that patients who have been grumpy and irritable their whole life will have a grumpy and irritable death. If you have been loving and giving and warm your whole life, your death will be warm and loving and giving, and will be maybe an easier transition. Hearing is the last sense to go. So as the patient's family comes and they spend time in the room until the patient passes, all kinds of conversations go on, whether, should we go get coffee, or do you remember the time dad did such and such? Whatever the conversations are going on, the patient can hear. Patient hears everything you say. Be very careful what you say in a room with the dying. So that is the last sense to go. I already told you how the voice changes, and there is something that we have in Massachusetts. I'm no longer in Massachusetts, but it's called the Death with Dying Act. It's legal in 11 states here, and it's medications that you would bring home. They give you clear instructions on how to take these medicines, and it's to end your own life. So if you have 6 months or less, there's certain criteria you need to get these medications. They give you a sedative that makes you go to sleep. You take the other medicine, and within an hour, you are actively dying. And it takes about an hour for the medicines to end your life.
Would this have an effect on the quality of death, Donna?
I don't think so. I don't think so. I don't know. I mean, is your work finished? Is your karma complete? All those things. I mean, who can judge? I don't know. But physiologically, it's no different than a death that I've been speaking about. All the same things happen. They'll have the death stare, the death rattle, all those, they might have terminal agitation. Everything is the same, physiologically. There are some things I have noticed that to me are amazing, and I really think that we can decide when we die. I have seen somebody waiting for someone to come visit, a daughter that lived across the country. Her flight wasn't coming in, till such a time. And the patient said, I'm not going to go until I see my daughter. And darn it, if she didn't just wait for that. And when the daughter arrived, she passed. Also, I have seen that the patient doesn't want to break that cord and completely leave if there's people in the room. So when every few hours, the nurses will come in to change the sheets or whatever, and the family will leave, and then the patient will pass. They wait for them to leave. And I've also seen patients set a date. Well, my daughter or someone's getting married on the 4th, and I want to stay alive until the 4th, and then they pass on the 5th. So I find that very interesting that we have some choice in our destiny. Now, I don't have pictures of the cords. I have, because I work with chakras and energy, I sort of have a feeling of what they're like. And this is what I would imagine the cord looks like. A very magnetic, to me, energy feels like if you've ever, as a child, how you blow bubbles, soap bubbles, and they're sort of like, what are they? There's a feeling to them. They're rubbery, bouncy, and that is what, to me, energy feels like. So when this cord is completely severed and the crown chakra closes, the cord is cut, sometimes we'll hear a big grunt, or they'll grind their teeth. Some people I have seen have made a dramatic movement where they were lying in bed and they'll sit bolt upright and then fall back. And that was, the cord, and that is the moment that they have departed. And the energy in the room changes to a very sweet sorrow that is beautiful. It's not grieving. It's not sad. It's quite beautiful, just like the baby who comes into the room and brightens up the room and is a beautiful event. I have also spoken to people who have been resuscitated. So they have passed for maybe 3 or 4 minutes, and we have resuscitated them through CPR, and they come back. And maybe 5 or 6 patients that I have spoken to all have told me the same thing. They entered a world of total acceptance, the most blissful acceptance that they've ever felt, and that it's very hard to come back into the body. They don't want to come back, but they know they have to because they're not finished. And after that, they no longer fear death. Any questions up until this?
It is not a question,
Yeah.
but I in my family, there has been exactly what you said. The room and the atmosphere reminded me, I hadn't assisted to dying and death before, and I have had this atmosphere as if some baby comes into the world. There was also an exact memory of the situation, of the air, and it was of the surrounding, unbelievably elegant and touching.
Yes, it is.
Yeah.
Yeah. Yeah,
and we
I
didn't
agree.
want to let go this person, like the room and the atmosphere was like, not of grief, but because it was so expansive. It was great.
I think it's a great honor to be with someone when they transition, to keep them comfortable and help them and help the family, because it is a beautiful event. It's quite honoring. Any other questions?
Yeah, hi, Donna. It's Michelle. Hi, thank you for your
Hi,
wonderful
Michelle.
presentation. Hi. Yeah, so when we die, it's because we've run out of energy. Is that a way to phrase it?
Yes, energy leaves the body physiologically. Everything stops. And you know, I think before we had modern x-rays, we don't know what people died of. And it seemed to be more of a natural death. And it, you know, so many people have cancer. Maybe that is our natural death, because otherwise you would die of probably something horrific. But anyway, yes, it is. It's the you've run out of energy. You've made your commitment. How long you will stay on this earth, and your commitment has been fulfilled, and you're going off to the next assignment. Yes.
Yeah, and the cord, is the cord the energy that leaves? And is that what you?
My own personal belief in how I view energy when I work with someone, I feel like the greater source above is, you know, this big ball of light. And from that light, there are strands that hang down into each one of us. Those strands, we have cords to each other. We have cords to our loved ones. Most of those cords we hope are healthy cords. They're not unhealthy cords, because if they are, they need to be cut. So yeah, it's called a spider theory, that, you know, the great divine light is the body of the spider, and the legs are all the little spikes that hang down, and they incarnate into us. So that spark of light comes right into us at birth, and right out of us at death.
Thank you.
I think. Okay.
And Donna, many
Yes.
macrobiotic teachers have and are dying of cancer. And you just said right now that cancer is not a terrible way to die.
No.
Did I understand?
I mean, if you have bone cancer, that might, you know, you might have bone pain, which can easily be treated if the patient wants to. I don't know anyone who wants to suffer with pain, but if you choose to, you don't have to have medicine. We don't force that on anybody. Usually we medicate the patient for the family's comfort, not necessarily for the patient's comfort. But no, it should not be painful, unless, of course, you know, you have broken bones or something that's causing you pain other than death, because the death process itself is not pain. It doesn't hurt to leave your body. But what you're dying of might be painful. A lot of times, if people, you know, have heavy smoking, they have COPD, to not have enough breath sometimes can be uncomfortable. To die without breath, we might put a little oxygen on somebody. They might not want it. You know, every situation is different, but I don't believe anyone that I have taken care of that's dying of cancer has had pain from dying. So I would say no, I don't think so. And of course, you know, at the end, the patient is unconscious and they have no muscle tone and they're not speaking. So you really don't know what they're feeling. But judging by, you know, what you can judge by, whether they're making facial grimaces or, you know, they're restless, that's how I could tell if somebody was uncomfortable. People look very peaceful when they pass. Just wanted to say a quick couple of things on burials, because I love this planet. I love the world that I live in. It upsets me so much when I see red cups on the beaches and trash along the highways, and people have lost the respect for owning property and taking care of the, you know, to leave this earth for future generations to see all the animals and plantations that we have. I find that cemeteries, you know, we had no other choices but to make cemeteries. Today we have options as to how we could be buried. And I'd like to share with you how I would like to be buried, because I have found that every year burying people requires 20 million feet of wood to make caskets, gallons of embalming fluid going into the earth, along with chemotherapy and drugs and antibiotics, concrete, copper and bronze, steel, all of that going into our earth. Does anyone even think of this? You know, of course, at the time of death and you're making arrangements, you're not thinking of the earth. I have found a good option. Now they have these burial pods. Right now, they only have them for cremation, and the ashes would go in the pod, and they are making larger ones for humans, which I hope they're here by when it's my time. But the human body goes into the pod. The pod gets planted into the earth, and a tree goes on top. And as you decompose, you are not embalmed. As you decompose, you become fertilizer for the tree. You become the tree. So instead of having cemeteries, we're planting forests, which is good for the earth. It's good for, you know, for CO2 and planet warming and all kinds of, it's a more natural way to be buried. And I told my children, I hope that they put a bird feeder in my tree. But these are called the capsula mundi. Like I said, it's just in the infancy of being in production. You can call certain cemeteries. They have more natural burials now, and there are some cemeteries that allow green burials. And I haven't seen a cemetery yet that allows this, but it's coming. It's coming.
There's a connection between burial and religion. And in our religion, we don't have cement and all these other things that you mentioned.
That's wonderful.
Actually, we do.
We do?
Actually, the cement is there, yes.
Then I know
The
less.
embalming and the casket, that's not there. The cement is
No.
there. I don't know why.
We'll find out from the
Okay.
last speaker.
That is the end of my presentation, and I would be happy to take any questions.
Someone just wrote in the chat about death doulas. Do you
Yeah.
have any, you're familiar with that?
I work in a hospital. We don't use them, but you certainly, if you have a home death or a place where they use a doula, that would certainly be, Nurse Julie, hospice nurse Julie, works with doulas, and on some of her posts, they will explain what a doula does and, you know, how that all goes along. I personally have never worked with one. Typically, we just have hospice that comes in, and hospice, you know, they're all nurses.
Mhm, mhm.
It could be very different, but I don't have any experience with that. Does anybody?
You can stop your screen share if you want.
Oh, sure.
No. Oh, on the screen.
Oh, no?
No, it's stop recording. I apologize. I had to go in and out, and I didn't get the full answer about, you mentioned cancer as a natural death in these days, and I didn't fully understand that. Why is it?
Well, what I'm saying is we have to die from something, right? We don't just, or not that I'm aware of, that we just lay down and our body stops. You have to die. Something has to initiate the dying process. For most people, it's either heart disease or cancer versus being shot to death or beaten to death or a violent act. So this is a more natural way to die
But don't we
than an
talk about,
accident.
sorry, don't we talk about death sort of like after you've lived many years, and those who have cancer and even children who have cancer, isn't that, I don't know, some kind of contradiction? Like they haven't lived their full life?
Well, who's to say? No one knows what our destiny is. You know, it's tragic when a child dies. However, that child may have had some agreement before they came to this earth that, you know, I need to learn this as a child and then I'm finished. I don't know. It's all in, I guess, what we believe and what our perception is. Certainly
Is there a
tragic to lose a
natural
child.
way to die as opposed to illness?
I don't know of any because people come to hospice or hospital because they're ill. I have never seen anyone without illness that has passed on. I would imagine, you know, you've lived to be 90, your heart gets so weak that it can no longer pump, you could die of heart failure. But again, that's a disease. That's, you know, something has happened.
Someone is asking here, what is an unnatural death?
To me, an unnatural death is perhaps maybe a suicide, hanging, a traumatic accident, a motor vehicle accident. We see a lot of gunshots, stabbings. That's not a natural death. The shock of the body is so intense. I can only imagine that the chakras have to shut down and cut the cord in such a quick way that the body doesn't even know it died. But I don't know, because in those instances, excuse me, in those instances when it's a trauma, after the patient has been pronounced dead, they still move. There's still neurological function. There's the muscles. It didn't have the time to slow down and shut down the way that it normally would. So to me, that's a little bit different. Even though they have no brain waves, they still have physiological, you know, like the energies are still, the chakras are still there. They're still functioning because the trauma was so abrupt, so quick.
What would you consider a coma? Somebody who's in a coma?
Well, you know, if the brain is swollen or there's, you know, some toxic reason, drug overdose or something, a reason for to be in a coma is it's just an altered state of consciousness, a very deep, deep sleep that the patient can't be aroused from. People can come out of coma or people can die in a coma. And what goes on while they're in a coma, we can only measure brain waves and, you know, responses to stimulation. We don't really know. There are things that we can do to elicit a response when someone is a coma. First, you would call their name. If they don't respond, you would just touch them or shake them. If they don't respond, you might pinch them. If there's no response, we resort to a sternal rub, which is your fist really hard on the sternum, which hurts. If there's no response, we would say that they were in a coma. And there's different reasons to be in a coma.
Well, it's very interesting, this understanding of what's natural and what's not. Tim is asking about your opinion on cremation.
Cremation. You know, after the body has passed, what happens to the physical body is, you know, I don't think affects anything other than what your wishes are, whether you're cremated or buried, or even if you were in an explosion and your body is all over, you know, different places, or it's never retrieved. I think what happens to the body personally doesn't make that much of a difference, because I see us like we're a peanut. And if you crack the shell open, take the peanut out, it doesn't matter what you do with the shell. It's really the peanut that's what we are, is the peanut. The shell can be tossed away.
Ooh,
I don't know.
Peanuts.
But you know, cremation is a great resource for some people, because it's, you know, it takes up less space to be buried from ashes. It takes a great deal of energy to get the fires. I don't know the temperature in which they burn flesh, but it has to be pretty hot. So I think it does utilize a lot of energy. Many people choose to be cremated. I guess I don't have an opinion either way.
And when you put
Charlie Brown.
Someone's writing the
Good
peanut theory by Charlie Brown.
Charlie and I have a lot in common.
Nina.
I have just had the thought, and this was not the first time I have it, when you get cremated, you're all minerals. And when you be put into a wooden box, you know, into the wood, buried into the wood, then it's all for nature in a way. I can't imagine that it is, you know, that it bothers Mother Earth.
Yes. Yes. I've had some of my pets cremated. Yeah.
Donna, can I ask a question?
Of course.
Thank you. And it maybe it's on topic, but it could be maybe not a question. Anyway, so I'm doing a lot of research on psychiatric medications and how they affect the body.
Mm-hmm.
Can you tell me what they do to the chakras? I mean, they block energy, I would imagine. Any idea?
Not necessarily, depending on the medication. You know, there's SSRIs that we use for depression, there's antipsychotics for schizophrenia. Different drugs, I think, can enhance the chakras. They can improve flow because it could improve, you know, brain activity. And how we think and what we eat and what we do, everything in our life is dependent on our chakras. So when your heart chakra is open, you might choose to eat better. You might choose to be kind to someone at the grocery store. You might not yell at people in traffic. But when your heart chakra is closed, you might choose to eat more lower vibration food. You might, you know, the chakras are magnets. We can see ourselves through other people. So right now, you and I are connected through Zoom in our well, I don't know if it actually works through Zoom, but if we were live, our chakras would be, you know, the expansion of my energy and your energy would come together, and we would have this energetic connection. And you would see yourself in me, and I would see myself in you. A lot of times when someone just really presses your button, just know that's a reflection of your chakras in somebody else. It's not them, it's you, or it's me. So the chakras are dynamic. So I do think that some medicines can help the chakras and help overall health, and some I think are a crutch and may not be needed. Maybe the diet needs to be improved, or something else would be more helpful. Depending
So how about
on the medication.
psychedelics?
Psychedelics stimulates the third eye, because that's the spiritual connection, and that is what's activated in a psychedelic. When you have a trip, it's the third eye being affected. Yeah. It's very popular now for with depression, anxiety. People are, is it ashwagandha? I don't know how it's pronounced. And there are people that will keep you safe during a trip. And what they're finding is that people who have had depression, who have been suicidal all their life, have gone on a mescaline trip or an LSD trip with someone who monitors you, and they see the world differently. They see how we're all the same. We're made out of all the same vibration, and it changes your life because we see the depth. When you're living on a very superficial layer of just work and stress and work and stress, and you don't see the spiritual nature in every blade of grass and every human being, I mean, that's life-changing. So yeah, that would definitely affect your chakras and affect your life.
Yeah. I just want to say that I watched a video on ketamine this morning. That's a hallucinogenic, and I saw a woman in the emergency room because I act as a clinician, and she told me there are side effects to any of these drugs, and some of them are neurotoxins, so they actually kill brain cells over the long haul. The study's only short haul, but yeah, she told me she felt like she was dying. So I mean,
what a way to go!
Fortunately, what a way to go, right? Yeah, she didn't like it, but so all these things do have, they can be too yin, too expansive. So that's weakening over time. So yeah.
Over time. Yes.
But short term, I hear what you're saying.
Yeah. Yeah.
When I think of yin and yang and what you said about the chakra, you know, from up there, it is in a way, it is the young energy that comes from.
Yes,
And the opposite is from the ground, from the earth.
yes,
Right?
yes,
And
yes,
then the movement that you did, I think this movement, but what
Mhm.
you meant is it comes right in, right?
yes.
And I always see this kind of a hat that is like
Mhm.
a sign when I'm thinking of how the energies come together with the chakras.
Yes,
Did you ever put this together, the yin and the yang?
yes,
Of the chakras?
yes. Of course, that's how energy comes into our body,
Mhm.
heaven's force and earth's force, and they clash together, and that's how the chakras are formed. And from them, we have, if those were the centers, and from them we have offshoots of pathways and meridians that feed every cell in our body. It feeds energy, life force. So that if you were to lose a finger and that finger was cut off, the blueprint, the energy of that finger would still be there, even though the physical flesh has been removed. And people have phantom pain or phantom sensation where you can still feel, even though there's no finger there, you can still feel your finger or your leg or a toe because the energy is still there. You can't remove the energy. It's interesting.
Donna, you've done a wonderful job. It's.
Thank you so much for having me. It
Yeah,
was a
you
pleasure.
presented it.
And just a reminder, if
beautifully.
you want to learn more about the chakras, to get my book, Let's Act Like Rice, in the back, I have all kinds of macrobiotic recipes and a lot of good health tips.
Excellent. Excellent.
Thank you.
Great. Thank you so much.